Hello, my NEET PG aspirants. Welcome to my YouTube channel. Today, I'm gonna discuss a very important topic of PSM, that is Community Medicine Universal Immunization Program. Almost every year, one or two questions has been asked from this topic. Okay, so let's get started. Universal Immunization Program. It is revised and updated. Here, we are gonna discuss about the vaccination of pregnant women, infant, and child. First of all, pregnant women. Only tetanus toxoid one vaccine is given. Usually, two doses are given. First dose is given as soon as the pregnancy is detected, and second dose almost 1 month after that, that is 4 weeks after the first dose. Booster dose is given if the two consecutive pregnancies occurs within 3 years, and if the woman was fully vaccinated in the last pregnancy. If it doesn't fulfill the condition, then we have to give the both doses even in the second or third pregnancy, or so more so ever. Okay. It is given in zero point 0.5 ml dose and intramuscularly. As you all know, tetanus is given intramuscularly. Then at birth, okay, when a child is born, what do you say? You'll say happy birthday. So here we are saying happy birthday to your PG seat. Happy birthday PG is the mnemonic here. Happy stands for hepatitis B, birthday stands for BCG, and PG stands for polio. Guys, remember oral polio vaccine is given orally, and other two vaccines are given. Hepatitis B is given intramuscularly, and BCG is given intradermally. Here you can also remember one point that BCG is given zero point 0.1 ml if the child is 1 month old, and is if it is less than 1 month old, then it is given 0.05 ml. Hepatitis B is given as soon as possible or within 24 hours of the birth. BCG up to 1 year you can give, and polio we can give within 15 days. The rationale behind the oral polio vaccine to be given within 15 days is we are going to discuss further in my video. Oral polio vaccine is the only live vaccine here. Okay. Now coming on to the next, that is at 6, 10, and 14 weeks. That is 1.5, 2.5, and 3.5 months. Here you can remember it with the mnemonic ROPE. Okay. R stands for rotavirus, O stands for OPV, oral polio vaccine, and PE stands for pentavalent. Guys, I've deliberately put penta is PE so that you won't get confused with PCV, that is pneumococcal vaccine. Rotavirus is given 5 ml, OPV is given 2 drops, as you know, do boon zindagi ki, and both are given orally, and pentavalent is given intramuscularly. Site we are going to discuss in the last. Pentavalent is replaced from the DPT. Earlier DPT was used to given, now we give pentavalent. So it contains DPT and two H vaccines, that is diphtheria, pertussis, tetanus, hepatitis B, and HIB, that is Haemophilus influenza B vaccine. Okay. Now, here you need to remember that two vaccines are given at 6 and 14 weeks. Guys, you can remember it like this. It is very important because many times it has been asked new about the new vaccines that have been added. That is IPV, inactivated polio vaccine, that is fractionated, and PCV is pneumococcal vaccine. You can remember two new vaccines and two doses are given 6th and 14th week. The 10th week dose has been excluded from that, and IPV is given intradermally, and PCV pneumococcal is given intramuscularly. You can also remember like P stands for plus, that is one more dose. Plus dose is booster dose is given at 9 months. Coming on to 9 to 12 months, measles or MMR or MR is given along with JE. Guys, you need to remember that measles and JE are the two vaccines, are like brothers and sisters. They are given almost, they have all the similar characteristics except for their diluent. Otherwise, they both are given subcutaneously, both are given at same time. Okay, and both doses, booster doses, are also given at same time. Okay. Now measles contains S, so you need to remember that S stands for subcutaneous here. So measles and J both are given subcutaneously. M, if you flip the M, it becomes W. So diluent for the measles vaccine is diluent distilled water. You can also remember diluent of BCG here. Not much asked, but you can remember is normal saline. Coming on to the 16 to 24 months, that is at around 1.5 to 2 years, four booster doses are given here. First one is DPT 1. You remember, just put a extra attention here that it is not pentavalent booster. Pentavalent is given only at 6, 10 and 14 weeks. DPT and 1 and DPT 2, two booster doses are given later on in the life. Okay, it has been asked many times, and examiner usually do this to confuse you, so don't get confused. Okay, other than that, measles or MR booster, and as I have already told you, where there is measles there will be JE, so measles and JE. And next one is OPV. As you all know, we give like up to 5 years of age, and booster dose is included in 16 to 24 months also. Okay, four booster doses we have done. Now, coming on to the vitamin A. Vitamin A needs special attention because many times questions have been asked from this topic. First dose is, you remember, first dose is 1 ml or 1 lakh international unit, and afterwards there will be dose will be doubled. That is 2 ml or 2 lakh international units. From second to ninth dose, every 6 monthly it is given up to the 5 years of age. So if we calculate, the total dose comes out to be 17 ml. Okay. Coming on to at 5 to 6 years of age, we give DPT booster to only one vaccine. One DPT booster 1 we have given at 16 to 24 years of age. Now at 5 to 6 years, we are giving DPT booster to only one vaccine. Okay, the last one is the TD, that is tetanus. Two doses are given intramuscularly, 0.5 ml, as you all know, at 10 years and at 16 years of age. Now, guys, draw this diagram with me. From this diagram, you can remember, diagram and mnemonic, you can remember where all the site of the vaccines we are using. Okay, just draw the diagram and dissect it into the two halves, left and right. Okay, now write here the mnemonic. MI patient, that is myocardial infarction patient, brought dead in emergency. So from MI patient, that is three vaccines are given on the right side of the body, and brought dead in emergency is given on the left side of the body. First of all, M stands for measles or MR vaccine, that is given in the upper arm, right upper arm, subcutaneously, as we have discussed earlier. Then IPV is fractionated inactivated polio vaccine, that is also given in the right upper arm. Measles is given subcutaneously and IPV is given intradermally. Okay. Now P stands for patient here, that is PCV pneumococcal vaccine, that is given in the anterolateral mid thigh of the right side. Okay. You can remember here that both the new vaccines, that is IPV and PCV, are given on the same side, that is right side. Coming on to the left side, broad dead in emergency, you can remember like B is broad dead is for BCG, that is given in the left upper arm intradermally, as you all know, as you have all received and have a scar mark of that BCG. Then second one is emergency, stands for encephalitis or JE. JE is also given in the left upper arm in subcutaneously. And last one is penta, or penta includes DPT also, so DPT booster and penta are given in the anterolateral mid thigh of the left side. Okay, from this diagram you can remember all the sides, and obviously OPV, rota, vitamin A are given orally. Okay, guys. Now we come on to some pearls or some important points you need to remember about the vaccines to solve your MCQs. First one, there are only two interdermal vaccines, that is BCG and IPV. Second one, two live vaccines should be separated by at least 4 weeks. That's why, guys, remember, we have given OPV, zero dose of OPV at birth, which we have given is to be given within 15 days, because the rationale behind that is uh, because you have to give at 6 weeks, you are giving other live vaccines like rotavirus, and OPV is also live vaccine. So the difference between 15 days and 1.5 months is 1 month, that is 4 weeks. So we cannot give OPV zero dose after 15 uh, days of life. This was the rationale that I was talking about. Okay, coming on to the some points about mission Indradhanush. That is, Indradhanush, as you all know, is a rainbow. It has 7 colors. So 7 vaccines have been introduced collectively to increase the universal coverage. It contains it. You can remember this by mnemonic DPT plus PMT and hepatitis B. DPT stands for diphtheria, pertussis, tetanus. PMT is polio vaccine, measles, and T is for TB, that is BCG vaccine, and hepatitis B vaccine. Okay. Last but not the least is Pragati, that is included in the intensified mission Indradhanush. It is proactive governance and timely implementation. It has been introduced by the government very recently to ensure the universal coverage and maximum uh, children to be vaccinated. Thank you so much, guys. Hope you enjoyed the video. Kindly like, subscribe, and share my channel. Thank you. All the best for your preparation.